Post-Finasteride Syndrome, Part 2. How do I treat patients that come to me in the clinic to alleviate their symptoms, okay? If you've seen a provider for this, it's very likely that they have already done some of this workup, but it's always best to start from scratch and just redo it. The first thing I'm going to do is I'm going to check a hormone panel. Make sure estrogen, testosterone, FSH, LH, make sure that the hormones are in play, okay? I'm going to make sure that you have already stopped using the medication, that you're not using an alternative. So that is where you start. You start with the hormone panel. For some men, if the testosterone is low, it's out of the range, supplementing testosterone can be very helpful, okay? Bringing the levels of testosterone back to normal and in turn, getting the DHT levels back up, okay? That is kind of step one after you've done a hormone panel workup. There are other things that you can do which are a little off-label, but I have seen work in some patients, okay? These can be a little more tough to prescribe and find, but it's something that you want to discuss with your medical provider professional. Some of these include discussing or talking about a DHT derivative like Proviron to see if this can help elevate those DHT levels and get people back to normal. And even I have seen in some men in clinical practice when I was in training and even later on, where they will get on a hormone blocker for a very short period of time to just reset the FSH-LH axis, okay? This would be what we call anti-deprivation therapy or anti-hormone therapy. So you get on a testosterone blocker just for a brief period of time to hopefully, the hypothesis is reset the level of enzymes in the blood such that you can continue to convert back to DHT. Okay, again, these are kind of gray areas because this diagnosis, the treatment for this condition, there isn't a clear guideline on this. So you have to be able to try different things. If that doesn't work, what I have seen work in some folks is actually a prescription of Clomid for a short period of time, maybe 4 to 6 weeks, to see if, again, that boost in the testosterone, endogenous testosterone, and maybe a surge in some of the FSH, LH hormones afterwards can help alleviate some of these symptoms. These are things that you can start with. There are other things you can do, but that's going to be patient-specific and try to address the specific symptoms that they are having. Okay, that could include an SSRI, it could include something like Cialis or tadalafil. There are a variety of different ways to treat this. The main thing you want to do is treat the patient, treat their symptoms, and make sure that they are improving. Guys, I hope this helps. And as always, give me a follow, give me a like, and let me know if you are experiencing PFS.